Okay, now the next presentation is by Nazia Shaheen. Nazia cannot make it here today, so in fact we have the pleasure of Marewa Glover here. Marewa is, please, if I get this wrong, tell me, the director of the Centre of Research Excellence for Indigenous Sovereignty and Smoking in New Zealand. But equally importantly, Marewa is a mentor in the KAC, the Knowledge Action Change Scholarship Program. And I do believe that Nazia was your mentee. So Marewa will be answering questions on the presentation about empowering lady health workers for smoking cessation, lessons from the Rural Pakistan Initiative.
Hello everyone, and my special thanks to KAC management for providing me an opportunities. My name is Nazia Shaheen, KAC Enhanced Scholar from Pakistan. My first level is sustainable and cost effective successfully completed with title Lady Health Workers Smoking Cessation and Smoke Pollution Initiatives in Rural Pakistan. Its background. In Pakistan, tobacco smoking and indoor smoke from cooking fire pose significant health risk, and health workers LHWs are main cadre and basic health unit in delivering health education in rural areas. The project tested the feasibility of integrating smoke exposure risk messages, smoking cessation advice, and tobacco harm reduction into LHW's routine responsibilities. Introductions. Exposure to household smoke pollution from second-hand tobacco smoke and indoor burning of biomass are risk factors, preventable diseases, and premature death. LHWs are group who could be mobilized to affect change. Objectives. First, translating tobacco harm reduction as a public health strategy as a life-saving approach. Second, providing tobacco smoking cessation and exposure to indoor smoke solution tailored local needs. Third, integrating tobacco prevention into health education at BHU level. Methodology. Out of 86 basic health units from 3 tehsils, amongst 12 BHU were selected for developing their understanding on how to address the problems of smoking and breathing into smoke at household level. 10 lady health worker supervisors and 161 LHW from 12 BHU across the 3 rural tehsils received training in November 2022. These 161 LHW served 1,54,000 population and household 25,700 over the 12-week delivery period. Results: 25,700 household baseline survey identified 51% households had at least one person who smoked. 85% households were experiencing indoor smoke pollution from cooking fires. 74% who smoked and 32% who did not smoke reported experiencing at least one smoking exposure symptom. Cough, phlegm, breathlessness. LHWs also reported that there was later awareness of the risk associated with exposure to inhaling tobacco smoke 35% and cooking fires smoke 24%, awareness of less harmless alternative to smoking was very low 8%. Conclusions. Overall, the project demonstrated the feasibility of LHW in delivering messages and advice to reduce smoking and indoor smoke exposures. Further research can investigate the impact of such initiatives and test whether the model can be replicated in similar socio-cultural other low and middle income countries. Thanks.
Microphone.
So, Marewa, that's great. I'm glad that you have given guidance to somebody who is working in at the coal face in terms of healthcare provision in an LMIC where tobacco consumption causes so much harm. I always have this concern, if I may, that somebody like this lady and people who go and do the kind of sort of coal face work, we tell them about tobacco harm reduction. But did this survey research include, when they mentioned safer alternatives, what were the products they showed? And why did they jump into THR before talking about a broader range of cessation options, which also include THR? Was there a reason they chose the way they did it?
First, I want to say it was a great honor and experience to mentor Nazia and previously Kamar, her husband, in a previous year. So he also did a project where he was introducing customers through retail outlets to oral nicotine pouches. So they were, so that's another study. So Nazia's work, in some way, in answer to your question, carries on with this concept of introducing people to alternative, safer products. And just, a lot of it is exploratory, given the lack of research and the lack of attention on these harms in this is especially in rural areas in Pakistan. So in that way, they're kind of jumping ahead, they are. But, why waste your time when you could jump ahead to a solution that we're finding in other parts of the world is working? So the products that, part of this project was teaching the lady health workers. Now, the lady health workers is a massive program in Pakistan. They've been going for decades now. And the lady health worker program basically are community health workers, and I don't know if you noticed how big their area is. They live in an area, their house is seen as a bit of a clinic as well. People can go there, and they have a target to visit each household on a what looks to me like a fairly grueling program, and they have been engaged in delivering health messages across a whole range of health, products and health topics. This was, I think very innovative and out there in terms of the Lady Health Worker Program. And I do remember hearing about the Lady Health Worker Program at World Health Organization. It's very, very difficult to get engagement, to get in there. One of Nazia's benefits was that she is an ex-lady health worker herself. And I think and she's an insider. She lives in this community, she knows the language, she knows the culture, she knows how the lady health worker system works. This is not something that could easily be replicated by outsiders. So fascinating. They did ask if there was anyone who wanted to try a product. The products were nicotine replacement products, oral nicotine pouches, and snus. I didn't know they had snus in Pakistan. But, and there was, I recall, great interest in, yes, wanting to try these products. This wasn't an evaluation of a cessation approach. It was really a feasibility study looking at, could this be achieved? And I think the reach is just massive to be able to tap into an existing community-based health delivery system at this very primary level and deliver these tobacco harm reduction messages and education. I'll leave it for questions. Okay. Otherwise, I'll just keep commenting.
Thank you. Any other questions? Yes, please.
Hi, I'm Samrat from India. I had two questions. One is, if some of the participants tried these products, did the report record some of the responses, what they felt about it? And the second is, was there some assessment about the affordability of these products?
The products were given free, I believe, and it wasn't an evaluation in the sense that there was a follow-up, survey. So there was a baseline survey done. The evaluation was reports from the lady health workers on their perceptions of delivering this. So it really was testing more the feasibility. What did the lady health workers think of doing this? They definitely wanted to do it more. The feedback was that this was good. They would like to be able to continue this. They understood this was a very important issue to address. I hope that people noticed that Nazia didn't just address smoking tobacco. And if you had attended the plenary, then you would have seen the figures put up there. 6 million people die a year from exposure to indoor cooking fire biomass. So this is a significant killer per year as well. As a KAC scholar, obviously the focus is tobacco harm reduction. And I said, well, you can't go in there without addressing this other significant source of risk. And she did that and did it very well.
I think you stole my question. I was going to ask about the link to the plenary earlier. Sorry.
Just a question of curiosity. Is it possible to get demographic data from this research, or at least very simple descriptive statistics? I would be very curious to see what is the proportion of homes where nobody smokes but they cook, or where they cook and smoke, or not. Is it possible to get this simple data?
We have got a paper drafted and submitted and under review, and I can go back to Nazia about sharing the results, the raw data. It was, I'm not sure if that can be teased out. I mean, she did mention there that 85% experienced exposure to, home air pollution. I think that the use of indoor cooking fires is quite ubiquitous and a significant risk. The smoking is, of course, mainly among men, and they are not there during the day. One of the things that Nazia mentioned was that the people that were more likely to be exposed to secondhand smoke were the children, people who were ill at home and staying in the home, and the elderly. So they face a higher risk. That children would often sit on the knee, on their father's knee, or on the male elder's lap while they were smoking. And I think one of the other things was about, so the risk is different for the different household members.
No, what? Could I maybe ask a left of field question? Because for me, what great thing here is this is part of the KAC Scholarship Mentorship Program. Could you just have one or two quick words? What did you take from this program, or a little bit about the program for people that aren't familiar?
The KAC scholars are recruited from across the world, particularly from people from low middle income countries. Low and middle income countries are encouraged to apply. It's given some people an amazing opportunity to learn about tobacco harm reduction and to experience running a project. The projects range, could be a video on a topic of a film, it could be educating health professionals or advocacy, it could be, running a small study. So they really, the scholars come up with that idea themselves, and KAC, and I would encourage anybody here, to please make yourself available as a mentor. It's a varied experience, and there are varied, projects out there and scholars. But I have had the pleasure of mentoring a few now, and this was especially, and Kamar's especially, I guess, felt really important. Low middle income country where there is so much risk on a daily basis, and not just from smoking, but there are many other issues, and to be able to give her that chance, and to, I guess, it would be great if we could get the paper published, to get that into the literature, because a lot of work that's going on is never heard about.
Fully agree. Very impressive. Thank you. Last time for one last quick question, if everyone has one. No? In which case, thank you very much.